Hey, this is Russ. I think the number one question people ask me when they know that I went through a knee replacement is, how did I deal with all the pain? Yeah, I've had pain for a long time, right? As of this recording, I'm 16 months after my knee replacement and I'm still dealing with my knee. So, how did I deal with it? How did I handle that? All right, I'm going to tell you guys how I dealt with it and how I handled it. Now, you might know certain things already because I've told you stuff before, but I'm going to tell you some additional things here, okay? So, as you might know, my knee was not doing too well, and I had 2 MUAs after the knee replacement. So 1 month after the knee replacement, I got a manipulation under anesthesia, and a month later, I asked for a second one. Yeah, it came from me, it didn't come from the doctor, okay? So I've gone through quite a bit, and I went to 80 physical therapy sessions within about a 6-month time period. So how did I handle that much pain? All right. Let me tell you that, the knee has pain, constantly while you're going through this. But the worst pain really was when the physical therapist was pushing on me. Yeah, I think if you've gone through physical therapy and if you had a physical therapist that pushes on your leg, okay, because I know there's some of them don't. I had 2 physical therapists that mentioned to me that they never even touched a patient ever. So there's different ways of doing it apparently, but I was one that was pushed, okay? I'm going to show you a picture here. This is not my therapist. This is my orthopedic surgeon. I've known him for many years, 15 plus years when we went in for the knee replacement. And together we've been in the operating room 5 times now, okay? Eventually we'll go in for the right knee, and I hope that he will be around to be able to do it for me at that time too. So, this is exactly the same way that my therapist pushed on me, all right? So I'm laying down. I'm not flat on the table, all right? Here, obviously, I'm flat on the table because this is the operating table. But in therapy, their tables are geared, so the back section kind of raises up, so you're kind of in an incline. So you're kind of sitting on an angle, right? But laying and sitting. Laying and sitting? So I would say probably a good 45 degrees, something like that. Maybe a little bit more of an angle than that. And typically when he pushes forward, because the pain is so great, you tend to back away, right? And you tend to hike up the incline. So if you do that, all of his pushing is really for nothing because you got to stay where you are. So when he pushes in, your leg moves, right? So your knee bends. But that wasn't happening for me. He pushed in, I would hike up that table. I would go up the incline. So we figured the only way to really stop that is to tie me down. Yeah. So those straps they use for moving refrigerators, into your house, the guy puts the refrigerator on the dolly, then he straps it around, right? That's what they used on me. Yeah. So it went under the table. He strapped. He'd hand it to me because he can't reach around. So I'd reach down with my hand. I'd reach down behind it on the other side of the table. I'd grab the strap from him, and then we'd bring it up, and then he would tie me down. We did this all the time, right? I would say it had to been a sight for those who saw this happen. Okay. Because I know that there's new patients all the time there, and where I went, they didn't have separate rooms. Everyone sees everybody doing everything, okay? So guys are in there rehabbing shoulders and things and knees. They're all in there together, okay? And some of the people there had seen me before, so they knew what was going to happen, right? But there's always new people, and I always thought that it's got to be funny to see this, okay? So they're strapping me down. Now I can't hike up, all right? So the way we did this was, and we had kind of a routine because I've been there so many times. I mean, that's a lot of physical therapy sessions, 80 over that time. He'd tell you ready? I go, hold on. Okay. So I'd take a deep breath. I'd exhale. I'd take another breath, and we'd go for it. So now he'd be pushing forward just like the surgeon was pushing forward on it. And I'm holding onto the table, okay, with both hands. Now, the pressure from him pushing forward and for me trying to stop that from happening because that's the gut reaction, right? We actually broke the table towards the end of my sessions. We actually stripped the gear on the table. We definitely broke it because I went in later, about 6 months after I stopped physical therapy. I went in to say hi and bye to them because I never got a chance to say goodbye to them because of the COVID-19 situations. And I asked him, I said, did we break the table? And he says, well, we don't push anybody on that table anymore. Yeah, we broke it. Hey, they made a lot of money off of me, okay? They can afford to buy another table. So anyways, I used kind of like my Taekwondo training, which the Taekwondo was the thing that messed my knees up, quite frankly. But I used that training to help me through it, okay? So it's a breathing thing, all right? So it's not like he sneak attacked me. I knew he's ready to do it. He'd ask me if you're ready to go, and I'd get myself set, and then we'd do it, all right? So I'd breathe in, I'd breathe out, okay? Yeah, it is a Karate Kid type of thing, isn't it? Breathe in, breathe out, wax on, wax off. And then I'd take a final breath, and I'd say, okay. So as he's pushing forward, I'm breathing out. And this is typical of what we do in Taekwondo. You know, when we punch, okay, we tend to exhale, right? And we yell, all right? So guess what I did? Yeah, I yelled when he's pushing. I mean, I outright screamed, all right? And I think those who have seen me before, they knew it was coming. So it's not a big deal to them anymore because they knew it. But new people, I could only imagine what they're thinking. Like, this guy is torturing this guy. I mean, I'm screaming like crazy. So that's how I dealt with it, all right? And I dealt with it with humor. As I told you guys, we were always joking. I crack a couple of jokes beforehand and crack a couple of jokes afterwards. I'd always say, Jim, you're killing me. And he'd always say, you're killing me. Because he had a bad shoulder. So for him, pushing hard was hard to do. And the other therapists there didn't have really the strength to push me. I was probably, well, one therapist told me I was too strong for her, okay? But the reality is that my knee was that stiff. It was very hard to push me to get anything. She would push on me and barely get even a grunt out of me, okay? So we needed Jim to do the pushing, and he pushed, okay? And we eventually hit 130 degrees under hard pushing. But on my own, I was able to do, I think it was around 117, I believe, something like that, pulling back on my own passively, actively 130 of push. Eventually, I ended up having to stop, so I don't know how much further we could have gone. We hit 130 like 3 times, something like that, and then I had to stop. So with the help of my jazz units, I'm now at about 120. Now, I am taking a slight break, as you know, right now because my knee started hurting a little bit again. It's kind of a stinging pain right underneath the patella. So the patella is your kneecap, in case you don't know what that is. And I'm feeling a little stinging pain. If I twist it a little bit or I move it a certain way, I can kind of feel a little sting. So I think taking a little bit of a break is a good idea. So I just wanted to tell you how I dealt with it, okay? That's how I dealt with it. Today, I don't really feel the pain much at all, other than this stinging pain. But it is stiff all the time. I can't go by a day without feeling my knee. It's got some type of issue. And there was a time when, if I got up, I couldn't walk right away. I have to kind of wait until it stabilized a little bit, and then I could start walking. I could walk pretty much right away now, but that doesn't mean I don't feel it, because when I walk, it is still stiff, and it's got its own unique type of nuance pain to it. Right? I don't consider it like knee replacement pain. This is more of a nuisance pain. So with the break that I'm taking now from being pushed, I'm only doing stuff like bending my knee on the stairs. You guys know that I like putting my leg on like a second step of the stairs and then leaning forward on there, okay? And I did that first thing today just to see how does it feel now that I'm not using the jazz unit. I haven't used the jazz unit for, how long now? It's been not quite a week, but it's 5 or 6 days I haven't used it, something like that. And it's tougher. to do it. So I know that, having not done anything on it for that time, just trying to let the knee rest a little bit, it's stiffened up a little bit. So I wouldn't doubt that I've lost a little bit of range as well. So luckily for me, Jazz has told me not to worry about returning the unit right away. He says keep it as long as you need it, and use it when you're ready to use it. So it's good to hear that. So I'm holding off a little bit, and we're going to take a measurement before I go back on there. I want to see if I can hit 120 again. All right. If I can't hit the 120, that tells me I'm losing range, and so you're going to have to do more work at that point. Before going back onto the Jazz, though, I think what I'll do is do more of these kind of like deep knee bends on the steers. Okay, do more of that, get it all ready, and then take the measurement and see where we're at. Okay, but I kind of half expect that it'll be less than 120. Okay, now I'm fully confident that once I'm back on the Jazz unit, it's going to bring me right back to where I should be, because it did that first time I got it back, right? So I'm glad I have that benefit of having it, at my disposal when I'm ready to use it. So anyways, that's how I dealt with it. And hopefully you guys find a method for yourself. And if this method works for you, try it. Okay. You don't have to be strapped down unless you need it, but don't let them push you right away. Okay. Just tell them to let you know when they're ready to do it. Take a deep breath, slowly exhale, take another breath, and as you're exhaling, let them push, okay? And scream. If you need to scream it, okay? It did help me handle it, right? I will admit that I do have a high tolerance for pain, but this is not the kind of pain that I knew I would be able to handle. This is extreme pain. You know what it reminds me of? Let me show you a photo here. Yeah. Kind of reminded me when Rambo got tortured. Remember that? Remember this scene? I don't know if this is Rambo 2 or something. Maybe was it Rambo 1? I can't recall. But yeah, I felt like I was being tortured in there. But I knew it was temporary. It wasn't for a long time. He didn't do it that much, but he did push me several times, for each session. So I'd scream several times there. But yeah, it's like being tortured. And I'm the kind of craziness that would say, is that all you got? Come on, let me see what you can do. I don't know if I ever said that to him, but that's what I'm thinking in the back of my mind. I think Rambo did something like that, right? I don't know. I haven't seen that movie in so long. Anyways, handle it the best you can. I'll talk to you guys next time.